So for more on the situation in Plateau State, we are joined by the Executive Secretary of the Primary Healthcare Development Agency, Dr. Livinus Miakwak. He joins us virtually. It's great to have you on the program, Doctor. Now, while the debate about whether or not pilgrimages are essential travels continue, let's talk about the vaccination drive in your state, particularly seeing that Plateau State has so far recorded the 4th highest COVID-19 cases in the country. First, what is your biggest challenge, really?
Yeah, actually, the main problem we've always had initially when we started these programs was the issue of people accepting the vaccine in the first place. And because there were a lot of myths and misconceptions. But immediately after we flagged up the vaccination on the 16th of March, which was done by the executive governor, a lot of people came out because if you can recall very well, Plateau was among the first 5 states in the country that were doing a lot of testing, and there were a lot of positivity among those tested. So we had to really go on serious, massive drive. Immediately after the first dose, people started coming out to accept it.
Now, having received over 105,000 doses of the vaccines, I mean, you vaccinated 44,000 during the first phase, which has ended already. Clearly, you will be vaccinated 44,000 during the second phase as well. So the question is, what happens to the outstanding, I think, 17,000 at least doses? Will they be destroyed, or will they be used for another phase of forced dose administration?
Yes, actually, from the data available, the 44,000 is the one that have been uploaded to the server. But there are a lot of backlogs, but we are hoping that we'll be able to meet up with the 52,000 that we're supposed to vaccinate. Because, you know, initially when the vaccines came, the whole idea was to exhaust all the doses during the first dose of the vaccine. But from the information coming from the national, that due to 1 or 2 logistic reasons, we may not get the second dose of the vaccine before that time. So we are advised to give half of it so that those that have received the first dose will receive the second dose of the vaccine. So for now, by the time we finish uploading the backlog of what has been done to the server, I'm sure we'll be able to meet up with the 50%.
Well, Dr. Livinus, it's been a pleasure speaking with you, and I wish you the very best in the vaccination drive. We'll go on a break now, and when we return, we'll be speaking with a journalist in India to get updates on the recent developments regarding the fight against COVID-19 and what's happening in neighboring Nepal. To join us again.